Dr. Manisha Patel. I was born and raised in Spartanburg, South Carolina. I went to undergrad and medical school at Duke, just 3 hours north of here, and then did a combined internal medicine and pediatrics training up at the Children's Hospital Philadelphia and Hospital University of Pennsylvania. It was there that I first found my love for caring for patients with congenital heart disease, both as in the pediatric realm, but also in the adult realm. And I saw a lot of the challenges that they faced as they transition into adult care. So I decided to subsequently train in pediatric cardiology, and I did that down at Emory. And during that time, during my time at Emory, I did some more focused training in adult congenital heart disease. And so that's my area of specialty, is adult congenital heart disease. I do carry a true passion for this, and I saw that there was a strong need in upstate South Carolina to provide a clinic that would reach out and be able to get a lot of these patients back into care. There are many pediatric patients that are born with defects in their heart, and many of these patients have also had surgeries or catheterization interventions, and because of the success of these interventions, these pediatric patients are now becoming adults. So they're entering their 20s, 30s, 40s, 50s, and 60s. And some of them are in care, and then some of them are actually lost to follow-up care. And so what I've done is specialize in this area to help transition patients from the pediatric world into the adult facilities. My primary goal is to get patients into care. So unfortunately, there are many patients that have been lost to follow-up, and they're lost to follow-up at a time that's extremely critical to their long-term quality of life. So there are patients that have been followed by pediatric cardiologists through when they're 17, 18, 19 years old, and then they go off to college and unfortunately sometimes lose that kind of care cycle with their pediatric cardiologist or adult cardiologist. And adult congenital heart disease is a rather unforgiving chronic illness. A lot of patients suffer significant problems when they enter their 20s and 30s. And so what I'm trying to do, one of my main goals, is to get these patients into care and keep them in care for as long as I can. I think the most important thing I can say is that oftentimes with the congenital heart disease, the surgical repairs they've had before, that there's still long-term consequences. It's not a complete fix. So a lot of people think they had the repair when they're younger, they're completely cured, completely fixed, and don't need to follow. Unfortunately, the majority of patients with adult congenital heart disease require other interventions as they get older. Some require other surgeries, some require other catheterization procedures, and so that's my primary reason for trying to motivate patients to get back into care and stay in care. The main reason I would choose Greenville Hospital System is because of the access to multiple different subspecialties and the coordination of care that's provided there. So, for instance, I have a unique clinic that kind of spans both pediatric and adult facilities, all of which is readily available through GHS. So if a patient were interested in seeing me, we would make it very easy. I'm actually housed through the pediatric cardiology department. So our appointment phone number is 454-5120, and we would coordinate a patient either being seen in our pediatric facility or adult clinic based on the needs of that patient.